To build a consensus in this country, because the real problem is going to be taking on those insurance companies, because they're going to be the ones. You're going to have Harry and Louise. Remember those ads with Harry and Louise out there saying this is awful what the Democrats are proposing. And so the second thing is you got to provide for. I think everyone should essentially be able to be, from age 1 on, essentially have the same kind of coverage you have in Medicare. It should be just universal across the board. We can afford to do that.
It's no secret that I support Medicare for all.
I don't. I understand the appeal of Medicare for all, but folks supporting it should be clear that it means getting rid of Obamacare, and I'm not for that. I was sworn into the United States Senate next to a hospital bed. My wife and daughter had been killed in a car crash, and lying in that bed were my 2 surviving little boys. I couldn't imagine what it would have been like if we didn't have the health care they needed immediately. 40 years later, one of those little boys, my son Bo, was diagnosed with terminal cancer and given only months to live. I can't fathom what would have happened if the insurance companies had said for the last 6 months of his life, you're on your own. The fact of the matter is, health care is personal to me. Obamacare is personal to me. When I see the president try to tear it down and others propose to replace it and start over, that's personal to me too. We got to build on what we did because every American deserves affordable health care. I'm Joe Biden, and I approve this message. Here, you have 160 million people who negotiated their health care plans with their employer, like many of you have. You may or may not like it. If you don't like it, you can move into the public option that I propose in my plan. But if you like it, you shouldn't have Washington dictating to you. You cannot keep the plan you have. So the 160 million people who have busted their neck, walked down picket lines, gave up pay, took hits in order to get significant health care available, you get to keep it under my plan. You don't have to give it up. It costs $30 trillion. Let's get that straight. $30 trillion over 10 years. Some say it costs $20 trillion. Some say it costs $40. What's a revolution going to do? Disrupt everything in the meantime? Look, the senator talks about his Medicare for all. He still hasn't told you how he's going to ever get it passed. He hasn't told you how, in fact, there's any possibility of that happening. He hadn't told you how much it's going to cost. He hadn't tell you how it's going to apply. It doesn't kick in for 4 years, even after it passes. We want a revolution. Let's act now. And Bernie still hasn't answered the question. How much is it going to cost? Who's going to pay for it? He talks about this savings. You know, in Vermont, they did pass the Affordable Care Act. They did pass Medicare for all. It doubled the income tax of the state. It put a 14% tax on income, withholding tax, and they got rid of it.
Throughout the Democratic primary, you made clear your opposition to single-payer, Medicare for all, and you have won the nomination. But in recent months, 20 million Americans have lost their jobs and many have lost their health insurance with it. Democrats overwhelmingly support Medicare for all. And it's especially popular among young people. And even your friend, Barack Obama, said recently that it is a good idea.
Democrats aren't just running on good old ideas, they're running on good new ideas, like Medicare for all.
So my question is, do you see a future where health insurance is no longer tied to employment? Will America ever have a single-payer system where health care is guaranteed as a human right?
Health care guaranteed as a human right, but taking away the right to have a private plan if you want a private plan, I disagree with.
Let's flash forward. Your president, Bernie Sanders, is still active in the Senate. He manages to get Medicare for all through the Senate in some compromised version, the Elizabeth Warren version or other version. Nancy Pelosi gets a version of it through the House of Representatives. It comes to your desk. Do you veto it?
I would veto anything that delays providing the security and the certainty of health care being available now. If they got that through and by some miracle, and there was an epiphany that occurred, and some miracle occurred that said, okay, it's passed, then you got to look at the cost. I want to know, how did they find the $35 trillion? What is it that we need? Listen to the experts. What do we need? And with all due respect to Medicare for all, You have a single payer system in Italy. It doesn't work there. It has nothing to do with Medicare for all. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single payer system.
The pandemic has exposed, as I've mentioned, so many weaknesses in the healthcare system. The most vulnerable, often Black and brown communities, have been handling much of the financial burden. Before the pandemic, you were against comprehensive single-payer system. Now, if Medicare for All came across your desk as the pandemic has hit so hard, would you veto it?
It's not going to come across my desk, but look, the pandemic has not only torn through our nation, devastating families and wrecking economies, it's exacerbated some of the worst inequities. I'm going to fight for health equities, but you don't need, the quickest way to get that is for Black and Latino Americans to have access to the Obamacare with a public option. That's the quickest way we can get everybody covered.
But hasn't this pandemic and the tsunami of layoffs shown the limits of private health care that is tied to employment?
No, it hasn't, in my view. There's countries that have, in fact, single-payer systems that hadn't helped them very much either. The question is, what do we do about rallying the pandemic and treating those who are affected by it? Everyone who's affected by the pandemic is access to free care for anything having to do with that pandemic.